I believe it was the Ebola outbreak in the Democratic Republic of the Congo between 2018 and 2020. Working during that deadly outbreak in the maritime crisis in North Kivu completely changed my perspective forever. We lost members of our team who were violently killed, and many times my team and I were under direct attacks ourselves. So when you see health workers risking their life during Ebola outbreak, so those experiences taught me humility and showed me that leadership is not about titles. It is about responsibility, presence, and making difficult decisions under pressure. Africa carries one of the highest burden of public health emergency in the world. Epidemics. We have climate shocks, humanitarian crises, conflicts, displacement, and natural disaster are happening simultaneously every day and often affecting the same vulnerable population.
So everybody's talking about AI innovation and the potential for AI to improve emergency response. So in the perspective of WHO Africa's emergency response, where can AI genuinely improve emergency response? Welcome back to Global Health Uncensored, a podcast where we sit with global health leaders, practitioners, and trailblazers to have honest conversations about global health issues and the decisions behind public health outcomes. I'm Dr. Banda Khalifa. Each episode brings a thoughtful voice to the table to reflect on experience, leadership, and the realities that shape impact in complex settings. Today, we are joined by Dr. Roseline Belizaire, who is currently serving as the Emergency Director at WHO Africa and previously the WHO representative to the Central African Republic and the head of the diplomatic mission. Dr. Bélizaire has held senior emergency leadership roles across multiple contexts, including Senior Emergency Manager, Emergency Preparedness Coordinator, and COVID-19 Response Manager in the Central African Republic, and earlier field leadership roles such as Deputy Incident Manager in the Democratic Republic of Congo. She has also served as team lead for the emergency program and as a health security and emergency officer, building a career at the intersection of operational response, preparedness, and high-stakes decision-making. With her joining us today, Global Health Uncensored continues to bring forward voices who understand global health beyond the headlines, leaders who have held responses where success depends both on technical guidance and also on trust, logistics, diplomacy, and coordination under pressure. Dr. Bélizaire, welcome to Global Health Uncensored.
Thank you. Good afternoon. And thank you for having me in this podcast.
Awesome.
My pleasure.
We are so excited to have you, especially times. But as I like to always go back to where the journey began, the early career, the academic journey, and where you grew up. If you can tell us about that journey.
Thank you so much for that question. So as you know, I am a medical doctor. I obtained my degree in medicine and surgery from the Latin American University in Havana, Cuba. After that, I continue my specialization, my clinical specialization in family and community medicine, which is for me a deep conviction that health is not only about hospital and medicine, but also about dignity, equity, and social justice. In my career, I work in Haiti, in my hometown country, in environment where people were suffering not only from diseases, but also from poverty, fragility, displacement, lack of access to healthcare and education. I can say extremely weak systems. So those experiences shaped me profoundly and gave me a very human understanding of public health. So after working for 3 years in Haiti, I received a fellowship from the Spanish Corporation to study epidemiology in Spain. So with the intention of eventually returning home. But the devastating earthquake in Haiti in 2010 changed everything. I immediately went back to support the Haitian government and stayed there for 6 months during that critical period. So afterwards, I continued working in Spain on public health. Then 2012, my journey in Africa began during the Malian crisis, when hundred of thousands of refugees fled to Mauritania. I was seconded to the WHO to support the establishment of an early warning and surveillance system refugee camp. But it was really the Ebola outbreaks in West Africa between 2014 2016 that convinced me to continue working on the continent. That was also when I officially joined WHO as a health security officer in Mauritania. Since then, my professional journey, as you said, has been marked by multiple emergency deployments across Africa. Some of the most significant included the yellow fever outbreak in Angola in 2016, the Ebola outbreak in the Democratic Republic of the Congo from 2018 to 2020, and the COVID response between 2020 and 2022. But in between, there were many other outbreaks and emergencies such as Marburg in Equatorial Guinea, Crimean Congo, hemorrhagic fever, Rift Valley fever, dengue, salmonella, legionella. The list is long. I progressively moved from clinical medicine into public health, epidemiology, and emergency management across Africa and other continents. So I'm doing those experiences that technical expertise alone is never enough. In emergency leadership, diplomacy, social and cultural knowledge and humanity are equally important.
Yeah.
So I also have the opportunity to work at the global level at WHO headquarters in Geneva as a senior emergency manager, me a broader understanding of global health, governance, and international coordination. As you mentioned, in 2024, I became a representative and head of diplomatic mission to the Central African Republic. So today, as emergency director for WHO Africa, I see my journey not simply as a professional career, but as a mission of service to protect lives, strengthen system, and help countries become more resilient before the next crisis arrives.
Amazing. That's such a fascinating journey. As you rightly said, for most physicians, there's a aha moment that lets you know that healthcare is beyond the boundaries of the consulting room. I have to say one of your closest colleagues to describe your leadership style in one sentence. What would they say about you?
I believe that my leadership style as a strategic, human-centered, action, result, and impact-oriented. I did excellence in accountability, but I also strongly believe in empathy and listening.
Mm-hmm.
Dr. Banda, in emergency preparedness and response management, a single leadership style. In moment of acute crisis, like the antivirus event we are currently dealing with, I'm sure my colleagues recognize the commanding leadership style. But in day-to-day work, I'm very democratic leader, but of course, with high performance standard, say that a combination of democratic and pace-setting leadership styles. At the same time, with the ongoing crisis in public health, I need to remain focused on the vision of the organization and on preparing the next generation to take over. So this requires from me more visionary and coaching leadership approaches. As I mentioned before, in emergencies, people need reassurance, clarity, and confidence. I try every day to create an environment where teams feel empowered, supported me from all the leadership, connected to a larger missions. And I also believe in leading from the front, leading from the example, and encouraging innovative and courage during my leadership journey.
Awesome. So, I mean, from your story, you've gone from field outbreak work to leading emergency preparedness and response for WHO AFRO. What's one experience that shaped the way you lead today?
This is an excellent question. When I'm thinking back, I believe it was the Ebola outbreak in the Democratic Republic of the Congo between 2018 and 2020. In 2018, we have 2 outbreaks, but people remember the 10th one. So working during that deadly outbreak in the humanitarian crisis in North Kivu completely changed my perspective forever. We lost members of our team who were violently killed. Him and I were under direct attack ourselves. So when you see health workers risking their life during Ebola outbreaks, or communities on survive conflict while still hoping for a better future, you truly understand the meaning of resilience and the true meaning of fight for your life. So those experiences taught me humility and showed me that leadership is not about titles. It is about responsibility, presence, and making difficult decisions under pressure while always keeping humanity at the center.
Amazing. So I want us to look at your mission in the next couple of years. You're stepping into the regional emergency leadership at a moment of real stress for global health. There are multiple outbreaks. There's a current panic around hantavirus, norovirus, and the others. What is the mission you want people across the Africa region to associate with your tenure?
Whoa, wonderful question. I think my mission as emergency director for WHO Africa goes far beyond managing, transforming the way Africa prepares for, responds to, and recovers from emergencies. Africa carries one of the highest burden of public health emergency in the world. Epidemics, we have climate shocks, humanitarian crises, conflicts, displacement, and natural disaster are happening simultaneously every day, same vulnerable population. So my mission is therefore to help countries move from a cycle of constant reaction toward a culture of preparedness, resilience, and anticipation. I strongly believe actually that emergency preparedness is not only a health issue, it is a development issue, a security issue, an economic issue, and even a dignity issue, a human right issue. A country that cannot protect its population during crisis cannot fully achieve stability and sustainable development. For me, this mission is also about strengthening African leadership and ownership in global health security. Africa should not only be seen as a continent receiving support during crisis. Africa has extraordinary expertise, as you know. We have innovation. We are a resilient continent, experience that the world can learn from. We have all those in Africa. So part of my mission is to help amplifying that voice and position the continent as a leader in shaping global trends. Another important part of my mission is building a strong partnerships. No single institution can manage today's emergencies alone in Africa or inside a single country. The complexity of current crisis required governments, regional institutions, international organizations, academia, private sector, communities, and done together in a much more coordinated way. So we need to unify forces, expertise, resources, while we avoid also fragmentation and duplication. In this context, as you know, of increasing emergencies and shrinking resources, I really put into my mission to have more collaboration and alignment are no longer optional for me, but they are essential. And I really want to carry with me, I can say, the other organization. So to finalize, I can say my mission is also about building systems that work every day, not only during outbreaks. My mission is also to build strong service systems, strong laboratory system, strong health logistic with members with the countries, strong workforce development, emergency operation centers, risk communication, all the area of our emergency. And I feel it's a strong responsibility, not only a mission, but it is responsibility toward the next generation of public health leaders. It's for me, we are operating in a very complex global environment. And at the end of the day, my mission is about service. I want to serve the African community, African countries, African population. It's about, for me, protecting lives, reducing suffering of those people living in extreme condition and extreme poverty. It's about a strengthening system and helping countries become more resilient before the next pandemic arrives.
This is an extremely well thought out mission, and I'm happy you covered most of the critical areas that really need to tackle. But in your own experience, what do you think is one misconception that people have about WHO AFRO's emergency work? I know it's difficult for people to contextualize exactly emergency work is for the WHO AFRO. So if you were to highlight one misconception, what would that be?
Well, I think many people think WHO emergency is only about responding after disaster or outbreak. It is not the first one I can identify. While in reality, a very large part of our work happened before crisis. Invest in WHO AFRO, we invest largely in preparedness, in prevention, in coordination system, and those really happen before the crisis is detected. So another misunderstanding is that emergency are only medical or health event. So emergency are also political, social, economics, environmental, and security issue actually. So
Yeah.
because when we look at emergency, they can rapidly affect trade, education, social stability, and even national security. So this is why, for me, emergency management is a multi-sectoral approach involving government, community, security actors, humanitarian partners, scientists, and development partners working together. One last thing I can say only people underestimate is the complexity and scale of emergencies in Africa. As I mentioned before, many countries, they are dealing with this multiple crises simultaneously. We have our countries facing flooding together with displacement, with armed conflict, with food insecurity. So in some places, the response team are operating in extremely unsafe environment. I think that part of the response are also misunderstood by the general public.
Awesome. And as you rightly said, the African continent is one of the continents that is burdened with a lot of emergencies. So sometimes, and the honest truth is that funding is also drying out. We need to come up with. So if you could, let's say, upgrade African emergencies response with three strategies, what do you think will be the three highest leverage changes? It could be in terms of speed of detection, workforce, supply chain coordination. What do you really think that these three elements are essential to making sure that Africa's emergency response is well equipped?
Wonderful question. Now, what I'm thinking, I think first, I would say sustainable domestic financing and investment in preparedness, because preparedness of the country, external funding. The second I would think is to invest in stronger surveillance and early warning system. Is powered by data, because without data you cannot take even based, I can say evidence-based decision. We need also laboratory and digital to respond quicker to emergency. And the third one is a better protected health workforce. In emergency, because we are in the front line affected, and we have also losing healthcare worker during emergency. So it's really a ultimate managing of the people that we have to protect them better during emergency.
I think this kind of areas that needs to be highlighted. But I mean, from where you sit and how far you've come, I know you've identified some delays in how emergencies are tackled. What would you say it's where the most bottlenecks are? Where do you see delays really coming from? Is it bureaucratic processes? Is it the politics of emergency procurement? What would you say it's the main constraints that we are facing?
So that's true. We have a lot of delay in emergencies. But what I learned so far, or what I'm living every day, is that delay in emergency response often comes from weak system rather than from a lack of commitment, of willingness by the responders. So in most situations, as you mentioned, in countries you have healthcare workers and partners, they genuinely want to respond quickly, but sometimes a structural and operational constraint in the process. And one of the challenges also is a fragmented coordination between institutions and partners. Data cannot slow financing mechanisms and also procurement bottleneck. For example, with COVID now, we couldn't receive the material from COVID from a country to another. Sometimes we have also legal framework between our countries to another. That's true. We have limited logistic supply chain capacity in most of the countries. And as I already mentioned, the rapid access to funds of the biggest challenge that we emergency. Even sometime when the resources exist, we have administrative force to release them are often too slow. And because us in the emergency, we have a speed that people in routine work cannot understand. And even more during outbreaks or humanitarian crises that just kick off. So another reality also I should mention is that many countries are simultaneously dealing with competing priorities. When they have so many emergencies, so government may be responding to outbreak while also facing economic pressure, while also facing climate shock, insecurity, displacement, armed conflict, and health emergency do not happen in isolation, as you know. And leaders are often balancing multiple urgent needs with limited resources. I think all those can be very some bottleneck that we find in responding to emergency.
Awesome. So I want us to look, as you rightly said, there are competing interests, and if we have to prioritize certain areas, what would you say is perhaps the biggest challenge the continent faces? If you had to name the single biggest threat to health security in the African region over the next 5 to 10 years, what should we be looking forward to?
So looking to the future, I think when we are looking to the future, the biggest threat is the convergence, as I mentioned, of multiple risks happening simultaneously. We combine climate change, rapid urbanization. Sometimes people don't think about it. Displacement, conflict, misinformation, antimicrobial resistance, emerging and re-emerging infectious disease. These challenges are interconnected and amplifying one another. So the future threat is therefore not only one virus or one outbreak. It is complexity itself. You can see today a country may face an epidemic while simultaneously managing floodings, as we see in Mozambique with the cholera outbreak flooding. We have also food insecurity in so many countries in the Horn of Africa. Conflict is still happening, population displacement, and economic instability in other countries also. So this creates enormous pressure on already systems. When you look at already influencing the spread of vector-borne disease, in some studies that we are looking at, we see that the mosquito, they are not biting at the same time. They have been adapted themselves to the climate change. Added to that, population movement, access to water and food. At the same time, we have misinformation that can spread faster than the disease itself, and it's undermine trust in public health measure. It is also a threat. That is why I can say that preparedness today cannot be disease specific only. It must be multi-hazard in order to prepare for the next 5 to 10 years. We need a multi-sectoral approach. We need a flexibility and adaptability of a system that can quickly shift their routine system to a response measure. Countries need also a system that can respond to severe crises at the same time, while we continue to maintain health services for the population. For me, it is the complexity, as I mentioned, that will be the biggest challenge in the next 5 to 10 years.
Thank you for that. I think you've summarized the key challenge that we will be faced with, a complex of health security issues. So it's been a rough ride for the past couple of, I would say, months. Everybody's talking about AI innovation and the potential for AI to improve emergency response. So, in the perspective of WHO Africa's emergency response, where can AI genuinely emergency response in Africa?
This is an excellent question because you give me the opportunity to talk about our newly released tool, We call it PDX. PDX means Preparedness Data Exchange. It is our newly AI enabled integrated preparedness intelligence system. So with it is a agentic AI and large language models. This brings together all hazard and preparedness, health system capacity information to between alert and decision making. So it is the first system of its kind in WHO, I can say in Africa, in the world actually, to perform a search and function. And when it is rolled out in the member state, enable them to identify immediate risk and predict future hazard. And we use feature to find support readiness and early response. Other AI related activities that we are doing WHO Africa include also an AI framework for emergencies in Africa. So in this framework, it is to convene an AI consultation that took place in Nairobi in March this year. And in the past few years, we're expanding also the use of epidemic intelligence of open, and those tools will also use for advancing AI in emergency in Africa.
Awesome. As we speak about AI and its potential role in emergency response, how do we also prevent AI from widening inequity in terms of data gaps, language exclusion, dependency on external vendors, etc.?
Wow, this is a wonderful question, actually. And it is a big debate that we are part of. So, as you mentioned, the biggest risk of AI is widening inequality, misinformation. So, if AI tools are not governed properly, they can reinforce bias, exclude vulnerable population, or spread information faster than fact. This can have very serious consequences for trust, decision making, and public health and response. I can give you an example. Recently, there was an AI generated video circulating online claiming that Uganda has detected a NiPV virus outbreak. So the AI tool has reused footage of the Minister of Health doing a previous and manipulated the content to create a completely false announcement. At first, it was very difficult to determine whether the information was real or fake, and we had to immediately contact the country authorities for verification. So this is to show how AI generated create panic, confusion, and operational challenges during health emergency. There are also important legal and ethical dimension that can note when talking about AI. So AI system in health emergency often rely on amount of data, including sensitive personal information. So we therefore need a strong safeguard around privacy, data protection, informed consent, accountability, and transparency when using AI in emergency. So we really work together with countries and institutions, but countries and institutions will also be clear about who is responsible when AI supported decisions affect people's life. So the solution is a strong governance for us, transparency, ethical oversight is also important, and investment in local capacity. What I can say about Africa is that Africa must not only consume AI technology, Africa must also help shape them, including the legal, ethical, and governance of framework that guide their use. Reason why our tool, we are really working together with member states in order to have all those aspects taken into consideration before a global release of that tool. So at the end, I think our AI should support human decision making, not replace human judgment, especially in complex emergency contexts where humanity, ethics, and trust remain essential. We cannot leave all those to AI. So we should continue as leader to play our critical role, but sustained by AI generated data.
Awesome. I'm glad that the ethical frameworks are being thought of as we plan to incorporate AI into emergency response. One major area I want us to also look at is the pandemic agreement that was adopted in 2025. I think the hard part recently has become its implementation, especially the debate around pathogen access and benefit sharing. But from the perspective of AFRO, what is truly holding it back? Is it a combination of trust, sovereignty, equity, financing, or enforcement? What is the main roadblock to making sure that the pandemic agreement that was adopted is implemented?
Wow, wonderful. What I can say is that the progress of the pandemic agreement is currently being constrained by disagreement on several of the most contentious issues within the PABs, pathogen access and benefit sharing annex. So the PABs annex is critical prerequisite for the pandemic agreement to enter into force, even though it has been approved last year. So, however, negotiation under the IGWIG, this is an intergovernmental working group on the pandemic agreement, concluded consensus on all substantive elements of the annex. So as a result, the IGWIG agreed to request an extension of the timeline for the finalization of the adoption of the PAB annex. So it is with a view to its consideration at the 2027 World Health Assembly. That's been next year. So countries still remember the inequity witnessed during COVID-19, particularly around vaccine technologies and also to countermeasure globally. So this is central. Trust is really central. When managing emergency, as I said before, trust is central. We want assurance that them will be fairer and more inclusive. So I want to recall here that no country until all countries are safe.
So I think there also must be some element of negotiable. So if a land's weaker than must have mechanisms should African countries still push for it to protect access in terms of financing, countermeasures, manufacturing, tech transfer, etc.
I think you said, I think Africa must include equitable access to vaccine diagnostic, therapeutic, sustainable domestic financing, technology transfer, and stronger manufacturing capacity of the continent. I think COVID is our, closest, I can say, memory that clearly demonstrated the risk of depending almost entirely on external production and supply chain during global crisis. So I think beyond product and technology, Africa also needs a stronger health system overall. These include a sufficient and well-trained healthcare workforce that is important, but it's not part of the PAB, a stronger laboratory network, resilient health infrastructure, reliable supply chains that we don't really have on the continent that we are putting in place actually, and emergency operation capacity that during crisis while we maintain access to essential health services for the entire population. So therefore, I think it's important in Africa, more investment in research, more investment in innovation, digital health, and local scientific leadership is also critical in the continent if the continent wants to become more self-reliant and better prepared for future emergencies. So at the end, I can say that Africa must also have a speaking. There is one of the highest burden of public health emergency, more than 70%. And African content experts must therefore play a central role in shaping global policy and solution at global level.
I want us to move a bit to something that has become a major point of discussion. As we are all aware, the US is now moving towards a more bilateral strategy where agreements have been signed with parts of Africa. Recently, in the news that Ghana declined to sign because of data access issues. Nigeria signed the agreement. Kenya also had difficulty signing this agreement.
Still, effectively, this is a wake-up call for the entire African continent. So any reduction or unpredictability in global health financing introduces a real risk for the health system, and particularly in countries already facing multiple emergency and competing priorities. So, however, it also sharpens a critical strategic health security cannot be externally financed indefinitely. For Africa, this moment reinforces the urgency of strengthening domestic investment in health system, deepening regional cooperation and pool capacity, and building sustainable, resilient preparedness and structure that are less exposed to shift in external priorities or geopolitical changes. So it is also a reminder that preparedness is not a luxury. It is a strategic investment in national stability, economic resilience, and security. Countries that invest in surveillance, laboratory workforce development, emergency coordination, and primary healthcare system will be better positioned to withstand future crises. At the same time, a country or institution like this global health are threat alone, but partnership must increasingly be based on shared responsibility, alignment, and sustainability and country ownership. Ultimately, I think the challenge is an inflection point. It can accelerate Africa's transition from dependency toward greater self-reliance, long-term health resilience.
Amazing. I think this lays out a very important strategy that Africa needs to adopt in order to weather through the storm of a more bilateral America First style global health agreement in part of Africa. Recently, it was reported that Ghana declined to sign that agreement based on data secrecy and privacy issues. I know other countries have signed, including Nigeria, but operationally, what does that shift mean for African health security?
Effectively, as you mentioned, there are so many ongoing on the health security, but I can say it is a wake-up call for the entire African continent. Any reduction or unpredictability in global health financing introduce real risk for vulnerable health systems, particularly in countries already facing multiple emergencies and competing priorities. So, however, it also sharpens a critical strategic reality. Health security cannot be externally financed indefinitely. For Africa, this moment reinforces the urgency of strengthening domestic investment in health system, deepening regional cooperation and pooled capacities, and building sustainable, resilient preparedness structures that are less exposed to shift in external priorities or changes. It is also a reminder for Africa that preparedness is not a luxury. It is a strategic investment in national stability, economic resilience, and security. Countries that invest in surveillance, laboratories, workforce development, local manufacturing, emergency coordination, and resilient primary healthcare will be better positioned to withstand future crises. At the same time, Africa must continue strengthening partnerships because no country or institution can manage, but partnerships must increasingly be based on shared responsibility, alignment, and country ownerships. Ultimately, this moment is both. It can accelerate transition from dependency toward greater self-reliance, stronger coordination, and long-term health and security resilience, what is really needed in order for Africa to be able to face what is coming next in the 5 to 10 years.
Awesome. Hopefully, this test drives Africa into a path of self-sustainability and being able to invest more in its own health needs. We can't end the session without talking about generation of leaders. You've trained and led teams at multiple positions and crises. What makes an excellent emergency leader in context? What skills would you think separate the best from the rest?
I think enough have very connected leaders in emergencies. So because the continent faces recurrent and often complex crises, as I already mentioned, there is a strong culture of collaboration, solidarity, and continuous exchange among public health leaders, experts, and institutions, of course. So We learn from one another, we support one another, and often respond together across our borders. I also believe that what separates great leaders in Africa is the ability to navigate complexity while remaining connected to a common mission. When you look at us as leaders in Africa, we have a different perspective. Perspective may differ, approaches may differ, and visions may vary from one institution or leader to another. But ultimately, we are all connected to the same mission. We all want to build a healthier, safer, and more resilient Africa. At the end of the day, we all want an Africa where access to healthcare is not a privilege. I want it, but a fundamental human right. This is what I'm advocate for everybody can enjoy wherever they are, regardless of geography, income, or circumstances. Everyone can enjoy a health system that is a fit for their purpose. So my fellow leaders and I, we never lose a sight of that bigger purpose. We never lose that bigger picture, middle of crisis, and we need not to act quickly when we have operational pressure. We maintain our focus to this bigger purpose.
So, to my fellow young professionals who are coming up, I know this podcast and this program is being watched by thousands of early career professionals. If someone wants to build a serious career in emergency preparedness on global health, what professionals that are coming up?
Wow. I think the best advice I can give to young professional is simple, because in reality, nobody ever feels fully ready to the biggest opportunities of responsibility. I think I can also say that growth often happens challenges first and learn along the way. Do not be afraid to leave your comfort zone. Some of the most transformative experience and opportunity in life happen uncomfortable, uncertain, or difficult. Growth rarely happens in comfort. And what I also can tell them is to ask questions. Ask questions, even the ones that may seem obvious to you. So we can also volunteer for difficult assignments. Put yourself in an environment where you can learn, adapt, and grow. Your career will not be built on knowing everything, but from the beginning on your ability to remain resilient, curious, and committed to continuous learning. So I also always tell my fellow young leaders constantly listen to podcasts, mentors. Everyone should have at least a mentor, a friend, and also what's the other one? There are three things that I always tell them to have. You need a mentor, a friend, and an advisor. Also, you should also learn from colleagues, learn from community. You should be open to learning even from people who disagree with you. Don't only learn from people who agree with you, because we will not the other perspective. You will be in a box. You don't see the broader perspective. And you should be open and to know that no one has perfect knowledge, especially in public health and emergency management, where the world is constantly evolving. The moment you think everything is usually the moment you stop growing. So we should be open to learn everything. So lastly, at the same time, everyone should stay grounded in science and evidence. So in today's world of misinformation, noises, and constant pressure, the middle of the care focus, know your strength, but also know your limitation and protect your integrity and your values. Yes, the final one, the human side of this work. Public health ultimately about the people. It is about dignity and service. Technical expertise matters, of course, but humanity, empathy, humility, and they matter just as much.
These are very solid and important advice that early professionals must incorporate as they continue to grow in the field. Thank you so much. But before we, there's a segment that I called Quick Takes, where I ask you very simple questions, and the idea is to let people know the other side of you, the non-emergency aspect, the non-emergency aspects of your stories. It's gonna be a very short question and then a very quick answer. Um,
Mhm.
so the first question is, what is the most underrated skill in global health?
Active listening.
Active listening. Okay.
Mhm.
The most important investment Africa should protect, even during funding cuts.
Investment in preparedness. That one I can tell you even though I just wake up in the morning. Continue
Okay.
investment in preparedness. Whatever the cost is, we should continue
We
investing
should
in
continue.
preparedness.
Okay. One thing you wish every donor understood in one sentence.
Well, I can say that donors should understand that short-term funding cycles cannot build long-term resilience.
Hmm. Okay. That's thought provoking. Best
Oh.
advice you ever received in your line of work.
I know that one. I can tell you also with my eyes are closed. The advice, the best one I ever received is that stay close to the people you serve, because leadership is not something done from a distance. It is
Mhm.
for the people, with the people, and by the people.
Okay. Stay close to the people you serve. Okay, that's
Yeah?
powerful.
Because the leader,
One book you think every emerging public health leader should read.
as soon as possible, everyone in public health emergency or public health leadership should read The Practice of Adaptive Leadership. It is a book I discovered in 2024, but I thought I discovered it too late in my life. It is written by Ronald Hayfis, Alexander Grashow, and Martin Ensky. It is a Harvard Business Review publication.
Okay. Hmm.
So you have all the information in order to
Okay.
have it.
I have to go look for it if I haven't read it yet. Okay.
Mhm.
One
Okay.
lesson you often teach others, but occasionally you forget to follow yourself.
Well, that one is simple question. Rest is also part of leadership, even if your inbox are strongly disagrees. But and I love that too because we know in emergency we don't take time to rest, but I always tell to people.
People to rest. Okay, that's fair. If you could instantly master a skill outside
Mhm.
of global health, what would it be?
This one is I can say, the one I'm trying to do every day is swimming.
Oh, okay.
hmm I want
Yeah.
to
So
deep dive. I want to deep dive in some ocean, and I really want to master swimming so I can be able to do it.
okay, okay. Um, Coffee, tea, or something stronger after a long day, or before the start of the day.
Definitely none of the above because I don't
Mm.
drink coffee. No caffeine diplomacy, no herbal negotiation, and no stronger negotiation either. So what I always do for starting the day or after a very long day is just a call with my son. It is the
Mm.
only meeting I attend where no one schedule a follow up and I still live smiling.
Interesting. Okay. Um, what habits has quietly served you well throughout your career?
Continuous learning. Continuous learning. I have never stopped learning. I'm learning every day. Actually, I'm studying law because I want to become, to advocate more for human rights in health. And I also continue learning every day. Now I'm learning about AI. I'm learning about climate change. So that can keep you, with the feet on the ground in your area of work, but also you can put something in the discussion in the table. So continuous learning, it is something that really quietly served me very well.
That is very true. I mean, going through your profile, I could tell that you're somebody who likes to always learn new things.
I
And
do.
our
And
final question is that you've been to several African countries, and I know African dish is kind of maybe closer to what
mhm,
you find in Haiti.
mhm.
Recently, I tried some rice from Haiti. It was called
Black,
black rice
black rice. I
with,
know it is my husband.
with mushroom and other things, and it was the taste looks. I mean, it tasted so close to the Ghana jollof, or it was certainly better than the Nigerian jollof. But the color was entirely different. So, I mean, having been to several African countries, what would you say has been your best dish so far?
Oh, one best dish? Wow, this is not fair. There are so many great African
Okay,
dishes.
let's say two. You can, okay, let's say you can mention two.
Yeah, because if you say two, I will want to say, I mean, to please people, maybe. Okay, because there are so many, choosing one is basically a violation of continental unity that I'm promoting. But if I have to pick one, I love chibujen. Chibujen is look like the rice that you described, and
Uh-huh.
it is a bit put out to Senegal. But I had did a taste of that dish in Ghana. I said next time I'm going to Accra, I should do it. But if I have to stay with only one dish, I will take chibujen.
Okay, I have to look for it then. Um,
Yes, you will like
well,
it. You will like it. Mm-hmm.
all right. I think this ends our amazing conversation. We've really enjoyed the conversation, and I've learned so much. Hopefully, my audience would also learn and enjoy the conversation as I did. So, Dr. Bélizaire, this has been powerful and very refreshing. Thank you for taking us beyond the headlines into the leadership, the tough calls, the coalition building, and the operational discipline it takes to deliver fragile systems. In one sentence, what's the biggest hard truth Africa next generation of emergency leaders should accept early in their career?
To leave their comfort zone, to
Mm.
learn and live in any place where the work is calling you. It should be a call from inside.
Awesome, awesome. Well, thank you so much. And thanks everyone for joining Global Health Uncensored. If this is your first time, welcome. We are on all the social media platforms: YouTube, LinkedIn, X. We are also on Apple and Spotify podcast. Until next time, I'm Dr. Banda Khalifa, and this is Global Health Uncensored.